Hello, MedTech Insight Intuitive. This is Dr. Jennifer Joe with my co-host, the fabulous Dr. Ami Bhatt. When Dr. Bhatt isn't hosting the show, she is running the Massachusetts General Hospital telecardiology program, seeing congenital heart disease patients, and teaching at the Harvard Medical School. When I'm not hosting this show, I see patients in the emergency room, urgent care, and hospitalist settings. We both support a number of traditional medtech and also up-and-coming digital health startups. We both believe that healthcare can be better, both for clinicians and for patients. MedTech Insights is a live weekly interactive talk show led by me and Ami, where we have two guests join us every week. They are digital health leaders. We love it when you write in, talk to us, tell us who you are, where you're from, and any questions that you might have for our guests. We have two really delightful guests today. As a reminder, this is live and recorded, and you can follow us on Facebook, Vanguard.Health YouTube page, and my personal LinkedIn page. All shows, and then sorry for the website. Sorry, I've been in Mississippi for the last week. So apologies. I'm kind of getting back into the routine. And Mississippi it's like 6 to 8. It's like 10 hours of travel each way. All shows are recorded and available after the fact on our website, Vanguard.Health MedTech Insights. And then we're working on getting it on as a podcast. Over to you, Ami.
Thank you, Jen. So to those of you who reached out, thank you for letting us take a little hiatus over the past week or two. We are happy to be back with everybody now. We are starting into an exciting season for digital health and medtech and biotech. I think, good news is worldwide, as well as here in the United States, even though some areas are still suffering and trying to get through it, the COVID numbers are coming down. It's this interesting 2-month up and down cycle that we've been having. But a lot of meetings now, not only virtual, but happening in person, and exciting to see each other together. A few that I'd like to just mention: the Convergence Forum will be coming up here in Massachusetts. That's going to be at the end of October, and Jen and I will be hosting live from there. So that will be towards the end of October. Also at the end of October, we have the Applied Health Innovation Consortium, hosted by the American College of Cardiology. A real chance, again, to bring together academia, technology, entrepreneurs, and both larger companies as well as small startups to really think about how we're changing the healthcare environment moving forward and making sure we're doing it in a way that we're aligned and not just parallel. And then, Jennifer, you have another conference coming up soon. Can you remind me the name of that one?
Yes, I will be at the Health XL Boston Global Gathering. It is next weekend, October 15th and 16th. Very excited about it. It's supposed to be a nice event. So please, if you're there, look for me, watch out for me. And the Convergence Forum, it's going to kind of be fun. It's a big deal. We're streaming live.
From a different location, so forgive us for whatever happens there. But
we are streaming live from a different location, and it's going to be digital health with the convergence, hence the Convergence Forum of pharma and biotech. So that's very exciting. And then you have some other things happening, right?
Yeah, so I think moving forward, and I'll say a few things before we introduce our guests as well. Both ourselves and all the people on our show represent their own opinions, not those of the companies for whom they work or with whom they affiliate. Now that I got that out of the way, a few other things to look forward to. We have a telehealth workbook that's come out with the American College of Cardiology for those who are really trying to implement telemedicine in a more persistent way in your practice. And so please keep an eye out for that. Our book in telemedicine and digital health is still the publisher with Springer, but all the corrections are done. So soon enough, we'll have that coming out. And we have some great co-authors for that who hopefully will be coming on the show too in the next couple months. I think that'll be exciting. Today, we have two fantastic guests with us. So we have Dr. Hansa Bhargava. She's the Chief Medical Officer of Medscape Education. She's a board-certified pediatrician. She's also a certified teacher in the Emory University CBCT Resiliency Program. Deeply interested in innovation in mental health, opioid disorders, and in women's health. She's been a contributor to Forbes, WebMD, CNN, and Thrive Global, and she co-hosts the Equity in Health Initiative at Medscape. She's also an executive member for the Council on Communications and Media for the American Academy of Pediatrics. Currently, Dr. Bhargava is working on research initiatives in maternal health and digital health with the University of Texas. And she's actually going to be speaking at AI Med coming up with Dr. Anthony Chang in January. So that'll be exciting. I guess the one other conference we didn't mention is that HLTH is going to be here with us in Boston. It's going to be exciting. If you're in town, please feel free to reach out to Jen and I. We would love to see you. There's a lot of great work that's going to be coming there. We also have Eric Buffkin with us today. He is the CEO of etectRx, and I'll tell you about him now too, so we can bring them on kind of sequentially. Eric is co-founder and CEO of etectRx. He likes to call himself an unreformed tech entrepreneur who was drawn to etectRx by the opportunity to help patients be well by actually taking their medication. His history, he holds a degree in electrical engineering from the University of Florida and an MBA from Rollins College. So today, why don't we start by bringing on Dr. Bhargava, and then in short order, we'll bring on Eric Buffkin as well. Dr. Bhargava first. So
Welcome.
Great to have you with us.
Thank you. Thanks for the opportunity, Ami and Jen. I really appreciate it.
Absolutely. So we talked a lot about kind of your history in your introduction, but will you maybe take us a little bit to the digital health side of the work that you're doing? Because you've had an interest in mental health and resiliency for longer than most people have kind of caught on to that. And you have kind of taken that and also thought about who are the groups that perhaps are not getting the same level of attention and care as others, and thinking not only about ethnicities, but also about gender. We'd love to hear a little bit about your story. I think Jen and I may know, but the audience doesn't, about how digital health has fit into that for you.
Absolutely, and thank you again for having me here. So I'm a board-certified pediatrician. I was in clinical practice full time for a number of years, and at the front lines in pediatric emergency medicine. And I pivoted to actually take an opportunity over at WebMD and was there for about 8 or 9 years, and that is where I just got very interested in digital, both digital communications, but also mobile, helping to build mobile apps, and also helping to do research using a mobile app as a platform to recruit patients in pregnancy, which we published in Nature Digital. And most recently, I have taken on the position of Chief Medical Officer at Medscape Education, which is a subsidiary of WebMD, in case a lot of people don't know that. And I'm really excited because at this point, we're involved in several projects, both on equity, but also helping out. I personally am helping to enhance research in digital using various algorithms. Specifically, Ami, you asked about mental health. So over the last few years, I've been very interested in that, and I'll be very honest. The interest began with, unfortunately, a family member who passed away from fentanyl poisoning and opioid addiction, and that was just really devastating for us as a family. And we started looking into it. My sister asked me why this could happen, and why there was no digital device that existed where the naloxone was 6 feet away from him that could have alerted family members and close friends. And even though there was another young man, in the other room, had he just been alerted. So that kind of also enhanced my digital journey as we kind of tried to look around to see if such a device existed, which it did not, and what it would take to do that. And then that kind of blossomed into deeper interest in mental health. So that's my story.
Oh, I'm so sorry. And it is a tragic, but unfortunately all too common story, as we've seen kind of with the opioid epidemic. And COVID has made it, in fact, a little bit harder, right? Maybe much harder for certain people. The way you have approached this has been great, because the approach has really been patient-centered in everything that you have been kind of writing and publishing on, which is how do we create something that is not coming from the clinician's perspective as a pediatrician or as a cardiologist or an ER doc saying, here's what we need, but rather, how does the patient need to interact with whatever that digital mobile health product is, in order to make it so natural for them to be able to use, that then it becomes a natural part of their journey. And then that's actually the best way to kind of improve their health. You recently, in fact, yesterday, put out an article thinking a little bit about, and use the word algorithm, but I'm going to stretch it a little bit to AI, thinking about algorithms and artificial intelligence. And the article you had posted was about maternal health. So I'll start with that, but if you want to take another direction, that's fine. Where do you see, because we hear the word AI, and a lot of people in the general public say that's something that is for the future. That is Tom Cruise Minority Report. It's not now. But in fact, there's a lot that we can do with algorithms and artificial intelligence that can probably improve healthcare now. Would love to hear you say a couple words about that, whether that's maternal health or mental wellness, wherever you'd like to go with that. But I think the audience would love that too.
Absolutely. And, mental health and maternity are some of the areas I'm interested in, but it doesn't mean that AI does not have benefits across the board. We know this, right? Where we see patients, for example, presenting with mental health issues in the ER, and we know that there's been an evidence-based AI algorithm that can predict suicidality, right? For me, I was very interested at WebMD, even prior to my journey with the opioids, on maternal health, because 60% of maternal mortality and morbidity is preventable, and 40% of women are not showing up for their doctor's visits after delivering a baby. That's astonishing, right? Like that, the way I compare that is, what if you had knee replacement surgery and you didn't come in for your post-op visit? Really? That's kind of crazy, right? So we actually at WebMD, part of the work I did was we tried to build an algorithm where we could actually use digital technology with AI nuances to be a digital doula, or somebody that was kind of the go-to for a woman in the post-operative period or post-delivery period. And I think that AI can really help us not only with predicting outcomes, but also, with efficiency of care. But I think, just like you said, we have to see it from the patient's point of view and follow the patient journey. So getting back to that maternal example, is that when, high-risk pregnancies can be predicted because of wearables or, vitals that are being followed. So we follow it from day one of pregnancy through the riskiest parts of pregnancy. And if there's people at risk, predicting those outcomes, having them come in more often, and then to delivery and postpartum care. So to end-to-end patient journey, and where can we actually help that journey by increasing the efficiency of care, and also an eye to equity and access.
That last point I think is so important, to equity and access. There was an article that came out, I want to say it was 2018, it was pre-COVID, and there was a group who was studying Black women mothers, and the group that they enrolled, they were looking at individuals who were in that postpartum setting and at risk for high blood pressure, either it had it or were going to have it. And the comparison was very simple. It was text messaging, hey, let's check your blood pressure and see what that is, versus regular office visits. Come in and see us, which is what we had always done for so long, and we'll check your blood pressure. And not only was the amount of monitoring better with the text message group than the come in person group, but in fact, the outcomes were better. And it was such a simple thing to say. We call it algorithm, we call it digital health. We make it sound not accessible. And in fact, texting was better for these mothers than asking them to leave their kid, their work, their job, whatever else it is, travel and come to a doctor just for a blood pressure check. And so just such an important way that we should think about our patients.
So I would just like to underscore that and the importance of engagement. And what is engagement? So speaking of, we are a live talk show. So we love when we have audience engagement. So I want to say a big thank you to James McKenna. He is an executive leadership coach for physicians. Thank you, Jane, for watching. And then we have Dr. Borb. So Dr. Borb, you're going to have to teach me how to pronounce your last name. Tuning in from Colorado. Lovely to have Dr. Bhargava. She's had the pleasure of hearing you speak before.
Oh, thank you. That's wonderful.
She is an internist, currently working in commercial strategy. So, I think one day we are going to have a show just dedicated to how physicians can be entrepreneurs and what that's like. And she does want to underscore that she's sorry to hear about your loss. And, I think loss is actually what drives loss, or taking loss and tragedy and taking it and turning it into something meaningful and useful. I think is incredibly powerful. So thank you for sharing. And then I'm assuming this person belongs to you. I mean, sorry, Dr. Cyril Abri, MD. I mean, she's an MD, PhD at Mass General. So I'm assuming we have all the.
So her story, I have to pause to tell you her story. So she comes from the Dominican Republic. She is here now. She has an 18-month-old at home, and is just the resident's favorite teacher, the patient's favorite doctor on the wards with me right now. Amazing. But she came around this morning actually with a digital stethoscope, and used it to both look with our residents, but also look with our patients and show them on her iPhone, here's what I'm hearing, here's what I heard before, here's what we hear now. And so I will tell you, this next generation, they're not afraid. They're not thinking of this as the future. They're just thinking of it as their now. And I think there's a lot of promise in a lot of what we're doing and the work we're doing, and incorporating those trainees in that work right now. I'll also give James McKenna yep, that's right. Fantastic, simple approach. That's right, Giselle.
I want to come round with you. Can I come round with you?
You can come round with me anytime. That's right. So two things I wanted to bring up. So one is just to go back, James McKenna, who commented first, has been a great coach for quite a few women in medicine. I mean, for everybody, all genders. But I will tell you that if you ask the women in medicine who have gone to him for coaching, really has had a great impact on helping people rise. And Dr. Joe and Dr. Bhargava, you guys have kind of done this on your own. But for many others, the coaching is very helpful in thinking about what the future holds and how to do something maybe a little bit different than what you were taught to do in medical school. So I'll just put that out there. I wanted
Dr. Borby. Hopefully that's correct. Okay.
Borby. Thank you, Kirsten. That's important. I want to come back, Dr. Bhargava, to the story you talked about. And again, tragic, but you said something interesting. You were talking about the importance of knowing what people are taking, knowing that there was medication nearby that could save them. And one of the things we think about a lot, both right now in mental health, but just in general in patient safety, is medications and how we use them and whether we're using them right and how we measure them. And I think that's one of the reasons that we thought that bringing Eric Buffkin here today along with you was really important. So again, Eric, co-founder and CEO of etectRx, and rather than I tell you what etect does, Jen, if we could bring him on and have him tell us, I think it's a perfect transition too. Eric, great to have you with us. Thank you for joining.
Good afternoon, Ami and Jennifer and Dr. Bhargava. I appreciate you guys having me along. I haven't commented, but I've been entertained and learning a lot about all three of you guys while I was sitting backstage and listening. It's been fascinating. Thanks very much.
Absolutely. So Eric, will you tell the audience and us just a little bit about etectRx and how you came to it and what you're working on with it? And then if you even have it with you, if you could show us some samples, we'd love to.
I'd love to do that. I mean, that's one of my favorite things. So as Ami mentioned, we think measuring things is very important as well. My background, you guys probably heard, I don't have nearly the illuminating background of our hosts and our other guests. I'm a simple engineer. I started out years ago designing stuff and connecting things. I happen to be fortunate enough that when all this internet connectivity was being put together in the 90s and 2000s, I was an engineer and they're fixing and connecting things up. And about 10 years ago, I had the good fortune of meeting my co-founder, a gentleman named Dr. Neil Giuliano here in Gainesville, who was working on some fascinating research on ingestible devices at the university. And I said, well, we ought to combine some of the stuff that I've done in wireless connectivity and what you've done and create an ingestible sensor. And so that was many years ago. And this is a much refined version, but we created an ingestible sensor that you can put any dose of medicine in it you want. It's just a regular capsule, and you can put a dose of medicine in here. When you ingest it, it actually gets powered up by your stomach. The acids in your stomach power this sensor up, and it sends out a very low power digital message. It'll send it about 3 feet or about an arm's length away from your body, because you don't want to be standing on the bus and have the person next to you in the bus hearing your information, so to speak. But it basically sends out a small message that gets picked up by a device we cleverly call the reader, and then either transmitted directly back to our database, or the reader then talks via Bluetooth to your mobile phone, where we have a nice little app that helps you keep track of what medicines have I taken, what medicines am I supposed to take. Oh, I forgot something, I need to enter one from the other day. And that information we then, and that's kind of the core of our business. So we measure this, and then we use this data to help researchers primarily today understand why people are taking their medicine, or maybe why they aren't. And then I saw a thread in here about texting be a great engagement mechanism. We actually work with a number of folks to, once the data is shown, or once we don't get an indication from a patient over time, we reach out to that patient and say, hey, are you having trouble? Did you forget? Have you lost your mind? What's going on? Can we help you? And that's kind of what we find as being the biggest gap we close, is simply providing that simple one little bit of information. Did you take your pill? Did you not? And help that inform the care that that the physicians do such a good job of providing. So that's kind of what we do. I'm sorry for being long-winded there, Ami, but that's kind of the short story.
This is fantastic. So, I have to say, I'm just thinking about a patient who said to me yesterday, I had 2 meds, I got a cath, now I'm taking 7 meds. And you just think about going home and having to figure out, what did I take, what did I not take, and the safety of that, right? And this was a patient who had a stent. We need to take this medication every single day to keep stents open. And so it's incredibly important that that's taken, but there's a bleeding risk. So if you took too much, then there's that. And so I think even when we think about patients in their daily care, especially those who have multiple medications, incredibly important for us to be able to both know that we took it and know that we don't overdose on it. How far, so you're doing this with research, which is great, because I've had patients, who come in and you say, please bring all your leftover pill bottles, and they forget, and then people are chasing me down for where are those pills. And so I think for research, I think it's great to know that patients are doing it. I think it's really helpful in the patient setting for patients to know. And I guess one of my questions to you is, how far are we from getting realistically something like this into, let's say, a geriatric practice?
That's a fantastic question. So I'll start out, Ami, by saying the what I just showed you is an FDA cleared device. So as a physician, if you have a particular patient you want to monitor for a particular indication, you can write a script, and the pharmacist can take this capsule, put that dose in it, and you can serve that patient. That logistically is there. In terms of its, we don't have a broad reach yet, so I can't tell you to go. You have their patient go to the corner CVS or Walgreens or whoever their favorite pharmacy and get it. We're focused right now primarily on doing research with folks up at Brigham and Women's in y'all's area, out in Colorado. Got some work going on in Texas. Primarily doing things about helping understand what some of the patient's patterns of behavior are around the taking of their medications. Some of the areas we're working in are in HIV and in opioid addiction treatment. So you think I work in this field, I would know the names of the different medicines, but unfortunately, I think my kids know Pokemons better than I know my own medications. So, but it's I believe methadone is the treatment modality that we're working with in one of the other studies. And we have a number of other target areas that we think have a lot of promise. You mentioned, and I think it makes perfect sense to me, you mentioned cardiology. The blood thinners we think are an excellent application for this, for folks that are post-MI or that have had stents that need that, they need to get on a habit. And what's the best way to get onto a habit? Anybody who's trained a puppy, anybody who's coached a child soccer team, the best way to coach them to get into a habit is to reinforce, in the moment for a period of time to get them in that habit, and then it becomes second nature. And we think this tool can be a really good tool for getting somebody into good habits when they need a change in treatment, whether that's a change in medicine or a change in life.
That's excellent. I'm laughing a little bit on the inside because I'm both trying to train a puppy right now and coach a soccer team. And so I could probably use some guidance. I don't think
it's like but your puppy.
But yeah, we have some work to do. Let me take that last part that you talked about, though, because we talk about mental health disorders and we do talk about medications. And there's two things. One about not taking the medications regularly, right? And then suffering from the disease process. And the second is potentially taking too much of that medication and putting oneself at risk. And then we talked about texting a little bit. And one thing that comes up, and Dr. Bhargava, I think you've mentioned this sometimes before when you've written and spoken, is the idea of having a community of people around you who also know what's happening with your health and with your medications. So maybe Dr. Bhargava, any thoughts from your perspective on the future of this kind of pill tracking and its utility in both keeping people safe and keeping communities engaged about medication?
Yeah, well, first of all, Eric, that is just such an interesting and widely applicable technology, it seems. Just so many use cases, but specifically in substance use disorder, I just think it would be such it's such a treasure box, as long as, not as long, but in addition with the pairing with the texting, because you need that continuity of care, right? And I do agree, Ami, that I think, with that continuity of care, like we all need that circle of care or connection, and, to have that inner circle kind of knowing that and helping people out, especially who have mental health disorders or substance use disorders, would be just another layer I would add on to it. I think, but it sounds like you're well on your way, Eric, and I'm so excited to hear about the research in terms of the behavioral findings, for sure.
Well, thank you very much. It's it's fascinating to me. Like I said, being an engineer used to hooking stuff up, to start getting into the into the field of understanding why people what they do is make some of the technology we use to assess it seem almost trivial. And I think that's where, when you start talking about digital health, that confluence is one of the most fascinating things about it. Digital is black and white. Health is anything but. And as you can convolve those two, that's an area of fascinating.
One arena that might be interesting, and Jen, I would love your thoughts on this too, is just specific to substance use disorder. Like, part of the issue is that there's very the standard of care is not well dictated in the step down units for rehabilitation in those cases. And I know that there's some organizations that are including Patrick Kennedy and some other leaders that are trying to, and Shatterproof, that are trying to put policies and standards of care in these facilities. But wouldn't it be interesting to see if we could also, use devices like yours, Eric, to help in the medical part of it as well?
One of the things we think is just an area that, and once again, learning about how some of the post-substance abuse treatment, having a recovering addict that has to travel to a clinic once a day to get a dose of the medicine that's supposed to be treating him seems like a huge disincentive. And if there is any of the tools, whether it's this tool or others, that can lower that barrier for somebody to get that treatment and help themselves and help the community and help everybody else by that virtue, seems like it'd be a no-brainer.
And Eric, that kind of speaks to also the access issues, right? That are like not just in substance use disorder, but also everywhere, right? Like the barriers to care are actually driving, especially in rural areas to because we're not like, there's health deserts in rural areas, just like there's food deserts in urban areas. So how do we equalize access, and this your technology certainly could help with that, as could other digital technologies. I'm sorry, I'm talking too much, but I'm just really excited about, being able to help fill those gaps.
Oh, I don't think you're talking too much at all, Dr. Bhargava. Our local VA serves the largest geographic area of any VA in the country, in North Florida. Who would have thunk? But they have people that have to travel 50, 60 miles. Yeah. And we've had conversations with them about how do we help you keep those people off the road. I mean, everybody on this call, and probably everybody that I don't know is watching us right now, has probably done 1 or 2 telemedicine visits in the last year and a half. we simply want to provide this technology and capability to help move that telemedicine further out into better function. So you're absolutely right.
I love how you say that, Eric, because you're right? We're trying to move it further out and closer to the patient. We've had this backwards nature of really bringing people in order to get their healthcare, and centralizing it at places that are more difficult for people to get to, both in terms of travel, but also time away from family, time away from home, cost of doing it, time away from work if you're an hourly wage worker especially. And I think also in a community where maybe you don't feel as safe as you do in your own home community. And that's probably just true. And so really taking healthcare and pushing it right back out and letting it live with the patient is what mechanisms like yours enable us to do. I want to go back to two other things because I know we've come up on time. So I think one idea to think about is also that when we have this environment of individuals who can perhaps also do pill tracking together with the patient, we're not just talking about clinicians, we're also talking about siblings or friends or spouses or significant other, right? So I think that's really important. And when we talk about mental health and we talk about substance use disorder and getting back out into the community, just the power of having that system and telling all those people, you are part of recovery for this individual, you are important to this, makes it less of a stigma and more of a disease process that we are all treating together. And I think that's the direction we need to get in. And Eric, I think your work and Dr. Bhargava, your work, both allow us to get at that idea of decreasing the stigma of mental health by really treating it like what it is, which is a disease process that we need to do. So I think it's incredibly important. We have one last quick question that came in. It's directed at you, Eric, and I would love Dr. Bhargava's thoughts too. Cost. The question of cost is coming out. We're talking about access. We're talking about getting this to people. How does one address cost when you're a CEO of etectRx and getting this to people?
I never get that question. I mean, so I will tell you one of the.
It's free. Everything's free.
Everything's free. This little guy right here, when you look at it, and I hate to go into the geeky world, but there's a lot of commonality between this and what's called RFID. You guys have probably heard of that, about being on everything from books, clothes to CDs. Do people still have CDs? I mean, anyway, they used to be on those things called CDs when you took them out of the store. So the key to making this cheap is, as the volume goes up, the cost goes down dramatically. One of the reasons we work in research primarily right now is we're at the early stages of manufacturing this. And so you mentioned, how would you treat a geriatric patient right now? You need a lot of money in your pocketbook today. Within the next very short period of time, next 12 months, 18 months, as we ramp the volume of this, it should go down dramatically. When I talk to folks that are putting together programs either at healthcare providers or in some cases employer plans, we talk about applications and uses of this technology, and we kind of focus on what are either high cost or high consequence situations. You talked about blood thinners, not a high cost drug, but a high consequence drug. And I kind of use the rule of thumb that for the next year or so, next year or two, you kind of need to look at this as, if each one of those doses is worth $1 to you to know, that's about the right mindset. So you may not want to put it on an aspirin. Then again, you may want to put it on a warfarin. That becomes the physician's call and the payer's call at that point.
That's wonderful. And I see some payers that are out there watching. So, the Progressive Blue Cross Blue Shields of the world who are watching, I'm just going to call them right out, or the Crossover Healths, or even the BMSs. There are people out there who all could probably help us with financing this to be able to, this and other similar technologies to be able to get it out to the people. Let me ask you both for kind of final thoughts for our audience about the variety of topics we've talked about. Anything you want to make sure that people hear from you today? Maybe first Eric, and then we'll end with Dr. Bhargava. No, Eric is speechless. Eric said,
I'm sorry. I thought you asked if anybody wanted anything.
Sorry.
Eric's so not used to all this, like,
my only comment would be, once again, I appreciate y'all having me out here to share what we've done technologically. I hope we can put it to good use to help the patients that you guys help every day. I'm honored to be amongst your company.
Thank you, Eric. Dr. Bhargava, final thoughts.
Well, I think first of all, Jennifer and Ami, this is such an important platform, and your voices here are just so important because innovation just holds a lot of hope and answers to a lot of the gaps in our health system, where we have a lot of crises going on, whether it's mental health or substance use or maternity care. There's just so much, and we have crises with disparities. And I do think that we can use technology and health innovation to hopefully bridge those gaps.
Wonderful. Well, thank you both so much. It's really been an honor to have you both on the show. The work that you have both done and continue to do is really inspiring to all of us as well as our audience. We will all be keeping track of you and what is coming from Medscape and from etectRx next. And to our audience, please remember, feel free to reach out to either Dr. Joe or myself, or to the people who come on our show. We're all very excited to hear from people who are doing similar work. Jen, I will give you last word.
I want to say a big thank you to our audience for watching so diligently as you do, engaging, participating. Big thank you to my host, Dr. Bott, and our wonderful guests, and the work that you guys are doing in driving leadership and innovation in digital health. So thank you, Hansa. Thank you, Eric, for being here. And as a reminder, we are actually, our schedule's been a bit erratic. We are live next Tuesday. What is it? We are in October 12th at 12 noon Eastern time, and we will have the CEO of Digby Health. So please stay tuned for that. Big thank you to everyone, and have a good Tuesday. Bye-bye.
Thank you.
Take care.
Sorry.